I'd like to speak a little bit more about sodium bicarbonate and potassium bicarbonate. Both have similar effects. It's the bicarbonate we're really talking about. The advantage of taking potassium bicarbonate over sodium bicarbonate is, of course, you get less salt, but you still get the bicarbonate. I still read shadows cast on sodium bicarbonate, like it's not the best thing, or you should be very careful, or maybe not use it at all. And we need to realize that sodium bicarbonate is very serious medicine. To paramedics in an ambulance, to emergency room doctors, to ICU, sodium bicarbonate has been around forever as a main medicine that is used in life-threatening circumstances, like cardiac arrest. Sodium bicarbonate has been part of the protocol for treating cardiac arrest in ambulances for a long time. And yet, going back 9 years ago, we start hearing that the American Heart Association is kind of putting the brakes on the use of sodium bicarbonate, beginning to put doubts in doctors' minds whether they should go for it so fast, whether they should ignore their experience for many decades and the scientific medical effects of bicarbonate. Why would they put on the brakes or cast a shadow of doubt? Why would anybody want to do that for sodium bicarbonate? If you're an incredible purist and totally against pharmaceutical drugs and any kind of intervention in the body, okay, then maybe bicarbonate is just one more external stimulation. But bicarbonate is something made by the stomach, spleen, kidneys. It's a natural substance that we create in the body, that we need. Can't live without it. But in emergency situations, sometimes the oxygen content, the heart stops beating, the oxygen content drops, acidosis takes over, the cells start producing lactic acid because of the drop in oxygen. Bicarbonate is the medicine of choice, or the natural substance of choice. It's not that sodium bicarbonate can never cause a side effect, like swelling of the ankles or the legs. Sometimes it does. And of course needs to be monitored like anything else. If something you take, including sodium bicarbonate, doesn't feel quite right, or you're already saturated with salt and just a little extra salt pushes it over the edge, sure, there are considerations. But bicarbonate can be taken safely by most people every day of their lives. Of course, when you want to use it to treat cancer and you go to high enough dosages to get your urinary pH up to 8, well, you can't keep doing that forever. That's why I suggest doing 10 days at that level, getting your pH, taking enough bicarbonate to get your pH urinary to 8, and then take 5 days off, or go back to half dosages. It's not a permanent solution to everything, like breathing too fast creates a deficiency in bicarbonates and carbon dioxide in the blood. Sure, you can address that with sodium bicarbonate and potassium bicarbonate. But if you never reduce your breathing rate, bicarbonate is not a really good compensation for that. Temporarily, even over a pretty good distance of time. So it's two related issues. It's almost impossible to be healthy when you're breathing too fast. Impossible. Meaning it's impossible to be healthy and have low bicarbonate and CO2 in the blood. Most people are breathing too fast, probably the 90% or more. Besides the conditions that we're living in our eternal self, breathing too fast, or our diet, we are being bombarded with poisons, chemicals, radiation, Wi-Fi, soon to be G5. Bicarbonate, one of the reasons it's become so necessary to monitor your pH and take bicarbonate is because even on this level, we need the bicarbonate to detoxify, to help us get rid of these poisons. I wrote my book on sodium bicarbonate, I guess it's 10 years ago already, when I learned that the U.S. Army recommended bicarbonate to treat toxicity, uranium toxicity in the kidneys. Bicarbonate is the perfect medicine for kidneys. Making all your water slightly alkaline with bicarbonate is very healthy, or drinking sparkling water. It's a very important subject because we're talking the basics of life. What is really acid alkaline imbalances? Acid is low oxygen. It's very acid is H plus hydrogen, positive hydrogen ions, no oxygen. Alkaline is OH, oxygen and hydrogen. With the basics of life. And even here we hear people trying to warn us against bicarbonate, when most people, especially who are not taking bicarbonate, would benefit enormously by taking bicarbonate.